On today's Two on Your Side Town Hall, New York adopts the CDC's new mask guidance. At least in a couple of days, we're going to take your medical questions to a local doctor.
Plus, an employment attorney is here to guide us through the impact on businesses and the places where you shop.
And what is changing for gyms? An executive with a chain of fitness centers here in Western New York will also be our guest.
And there is a lot to get to as we start a new week here and really a new era in the response to this pandemic. Hi, everybody. I'm Kate Welshofer.
And I'm Michael Wooten. We're certainly glad you're here with us. We've been poring over the questions that you've shared on social media or maybe emailed or called into us today. And just like in other states, there is some confusion here in New York about what this change to the mask mandate really means. Some people think it applies to everybody. Well, of course it doesn't, just those fully vaccinated.
Also, even the fully vaccinated might have to wear a mask in some places. And private businesses have a lot of leeway in determining their own requirements. So we hope to get you some answers tonight on both the medical and the legal side of all of this.
And joining us live for that is Dr. Nancy Nielsen, who heads up the planning team for vaccine distribution in our region, and attorney Jim Grasso, a partner at Phillips Lytle, who has been advising clients on workplace policies throughout the pandemic. It is great to have both of you here. Thanks for your time.
Thank you.
Thank you.
And Dr. Nielsen, we want to start with you. The basic guidance here is that you don't need to wear a mask if you're fully vaccinated unless you're in a place like a medical building, a congregate facility, or on public transit. Are there any situations in which you would still wear a mask outside of those exceptions?
Oh, absolutely. And that would be particularly if you are somebody who's especially vulnerable. Let's say you've had a kidney transplant or a bone marrow transplant, or you're on chemotherapy. In those kinds of situations, your antibody response may not be as great as everyone else's. And it would be the better part of valor for you to wear a mask. But other than that, people who are fully vaccinated should be able to feel very comfortable going out now without a mask, beginning Wednesday, I hesitate to say, just so you know, it's Wednesday.
Yeah, absolutely. That's when everything is going to switch over here in New York. It's already happened in some other places. Jim, one of the things that we have to keep reiterating to people is that private businesses can still enforce a mask mandate and have their own rules. Some have already done away with the requirement, but as of right now, a mask mandate is still in effect at Wegmans stores, Walgreens all over the country, Home Depot. Those are just a few of the chains that are still requiring the masks. We mentioned that you have been advising clients through all of this. It does seem tricky because no business wants to be the mask police, but you really think everyone coming in is vaccinated who is not wearing a mask? I mean, maybe it's just easier right now to require everybody to wear a face covering. How are you helping guide businesses through that decision-making process?
Yeah, well, I think the most important thing for businesses, they want to do what's right and what the law requires. And, you know, if the CDC and the state is going to allow unvaccinated people to go in without masks, I think you're soon going to see the businesses adopt that as well. It's going to be the honor system because there's really not going to be any way to, at a Wegmans or places like that, to monitor whether someone's vaccinated or not. So I think you're going to see likely those businesses go maskless pretty soon. But I'd like to just point out one thing. There is a difference between the commercial setting and the employment setting, because even though the CDC has said that their recommendations apply in all settings, the New York State information that has come out that's going to take effect on Wednesday indicates that it's going to be limited to commercial settings and not necessarily in workplaces such as offices and manufacturing facilities. So I think there's still a lot of confusion there about whether or not employers in general will be able to lift that.
Yeah, and that's exactly something that we want to talk to you more about. That's a really tricky thing to navigate for an employer, whether or not you're going to ask your employees, are you vaccinated, are you not vaccinated? Is that even something that they can do?
Yeah, they absolutely can ask their employees if they're vaccinated, and in fact, they can even mandate that their employees be vaccinated with limited exceptions. If someone has a medical condition or a religious objection, then they have to consider making an accommodation for that. But other than those two issues, they can mandate vaccines, and they can take surveys and and require their employees to tell them what their vaccination status is. So I think as things roll on and employers are going to want to be, have their employees take the masks off, they want to get up to 100%. I think there's going to be pressure building on employers to possibly mandate their employees be vaccinated.
Yeah, we talk so much about the mask mandate changing, but it's the physical distancing requirement that's changing too, and that can play a big factor in all these decisions. Dr. Nielsen, the point of this change from the CDC was to say to fully vaccinated people, you're safe. You have a great level of protection. You can get back to some level of normalcy. But you mentioned this just a moment ago. The exception to that would obviously be those who are immunocompromised. So what about those people and also folks who are allergic to the vaccine ingredients and can't get the vaccine, or of course children under 12, they're not yet eligible to get the vaccine. Those groups should all keep wearing masks, but I think a lot of people wonder if they go out into public places where masks are no longer mandated, does that put them at a higher risk? Because you don't know if the person beside you not wearing a mask is vaccinated or not.
Well, you're absolutely right, Michael. I mean, it's got to be the honor system, and you don't know. A person who refused to wear a mask and didn't get vaccinated, you will not know that, and you can't police it. But remember the issue. If you're vaccinated, you're golden. You really are. You are at extremely low risk of getting infected. The person who's at risk is the person who comes in unvaccinated without a mask. That's an issue. And that's what we hope will force everybody to really think long and hard before you don't take the vaccine. Now, when you talk about kids have not been vaccinated. Kids from 2 to 12 absolutely need to be wearing a mask, frankly, unless they're outdoors playing in a very wide open space. But anybody who's not vaccinated, a teenager or an adult or a kid who is not vaccinated should be wearing a mask. If they choose not to, and you don't know that, you can relax. They're the ones playing Russian roulette.
Yeah, Dr. Nielsen, you lead the planning team for vaccine distribution. And so, you've sort of walked us along this as well, that vaccinations have leveled off or they've gone down. And, there are still a lot of people who haven't gotten the shots. Do you think that this mask guidance is a way to kind of push those people, to encourage them to get vaccinated? Is that something that will work? And are we to the point where if we want to hit herd immunity, are we going to really have to start rewarding people to get the vaccine?
Well, I think pulling is easier than pushing. And if you offer them an incentive, for example, as the governor spoke today, to get into some of these arts venues, you're going to have to show proof of vaccination. And so, and the incentive, whether it's a shot and a chaser, or in West Virginia, the $100 for the young people, I hope that the ability to go about our lives in a much more normal manner will entice everybody to be vaccinated. The mandates get such pushback that let's portray this as freeing you to do what you want to do and what you used to be able to do.
Finally, Jim, if I'm a small business owner who has a store or a restaurant or some other shop, and I want to allow fully vaccinated people to come in maskless, but not those who aren't vaccinated, how do I police that? And I know you said that a lot of this is going to be on the honor system, but what would be your advice there? Do you maybe put somebody at the front entrance just reminding everybody of the rules, or do you just kind of take this hands-off approach? Because again, no one wants to be the mask police.
Well, I think there's a big incentive for businesses, restaurants to do that, because the guidance that's coming out on Wednesday says that if a business can prove that all their patrons are vaccinated, they don't even have to abide by the social distancing guidelines. They can have normal capacity like before the pandemic, but they're going to have to be able to prove that all of their patrons are vaccinated either through the Excelsior app that's come out or paper form. So they will have to have some form of checking, whether they have a quote-unquote bouncer at the door, but someone is going to have to be checking patron vaccination status if they want to take advantage of that exemption, that they'll be able to have full capacity in their places of business.
Certainly so many details to consider here. Dr. Nancy Nielsen and Attorney Jim Grasso, thank you both for sharing your expertise and what we know people have a lot of questions about.
Thank you.
Thank you.
All right, great to see both of you. And we should just point out, kind of as a footnote here, on a big day like this, with such big news from New York State, we would love to be able to talk to the point person here in Western New York for the state's COVID response. That, of course, is Lieutenant Governor Kathy Hochul. We reached out to her office today, but for the umpteenth time, she refused to speak with us.
Yeah, and she hasn't taken any local media questions for several months now, ever since the governor was first accused of sexual harassment. So we'll keep trying to reach out and see if we can get her to chat.